Okay, can you now admit them, yeah?
I think they are being admitted automatically.
Okay. Hello, everyone. Good morning, good afternoon. I see we have a people joining in. Hello, hi, everyone. I think as we wait for for others to join and maybe start at the hour, if you could just introduce yourself and which country you're from, just in the chat. Just say your name and where you're from. That will be helpful, the organization and the country. Okay, I see we have people from Zambia. ATCA is represented here. We have some stakeholders from South Africa, from Togo as well. Welcome, everyone. Okay, I think we have a quorum, and I think we can proceed from here. Thank you all for being very punctual. I think maybe this is the new Africa, right? So thank you all. I just wanted to say good morning again, good afternoon, depending on where you're joining us from. Welcome to today's webinar, E-Cigarettes and Shisha, the silent smoke screen. This will be a first webinar of a series that we will be having from the program, just showcasing the different findings that we have had in our studies. My name is Winnie Award from Development Gateway, and I am joined with colleagues who I will also be inviting shortly. I am part of the Tobacco Control Data Initiative. For those who are not familiar with the program, we collate and aggregate tobacco control data onto online platforms, and the platforms are country specific. So we will also be getting into that in a few minutes. I would like to acknowledge the presence of different stakeholders. I can see some members from government here. I can see some CSOs, I can see research and academia. I'd like to welcome you all. A bit of housekeeping before I introduce our speakers today. We will have 4 presentations. The first 3 will be sharing research findings, and the 4th will just be sharing where you can visualize the findings that will have been shared. We will have 2 minutes of Q&A after each presentation, and should you not be able to voice your questions, we will still be able to allow you to ask the question in the chat function, and we will respond to the questions in that chat function as well. Finally, well, not finally, maybe an important reminder to our speakers, because the webinar is just for 1 hour. If we could stick to the allocated time, that will be appreciated so that we can also have more time towards the end for more Q&A. And for colleagues who may be joining with an alias, please, in light of the sensitive nature of tobacco control, I would like to request you to update your names to the formal name or the official name. I can see so many people from Ethiopia, Nigeria. Karibuni sana. Welcome, everyone. Right now, I'd like to invite our speakers and just give a brief. I think you may have interacted with their bios, so I'll keep this short. We have Dr. Thomas Van Heijsten, who is our South Africa country lead for the Tobacco Control Data Initiative. He has been leading our in-country activities over the past 2 years. Next, we'll have Dr. Noreen Ndege, who's an associate professor at the University of York. She also leads our tobacco control research work at Development Gateway. The third speaker will be Prof. Catherine Egbe. I am sure many of you have already interacted with her as well. She's an associate professor at the University of KwaZulu-Natal and is also a senior specialist scientist at the South Africa Medical Research Council, and she brings on board extensive experience on the topic that we are about to discuss. Finally, we have Sembe Ali, who is based in Nigeria and is our Nigeria country lead at the Tobacco Control Data Initiative. She's been with the program for the past 5 years, and I'm sure many of you on the call have also interacted with her. At this point, I will share my screen. And I will invite the first speaker, Dr. Thomas.
Thanks, Winnie.
1 second.
Okay. Good afternoon, everybody. My name is Thomas Van Heijsten. I'm the country lead of the South African Tobacco Control Data Initiative team. Today, I'm going to be presenting some findings from the South African TCDI e-cigarette survey, which was conducted in 2022. My main focus in this presentation is going to be looking at the sequence of use between combustible cigarettes and these new and emerging nicotine products. Before we get started on this slide, there's some important terminology that I want to clarify. So the World Health Organization has recently released guidelines on how to classify these new and emerging nicotine and tobacco products. And I just want to go through some of those classifications before I get started to prevent confusion. So under new and emerging products, there are new and emerging non-nicotine products, there are new and emerging nicotine products, and then there are new and emerging tobacco products. Under those new and emerging non-nicotine products are electronic non-nicotine delivery systems, or ENNDS. Under the new and emerging nicotine products are electronic nicotine delivery systems, or ENDS, and nicotine pouches. And then under new and emerging tobacco products are heated tobacco products. Now, as I said, our study was conducted in 2022, which was before this terminology came out. So we grouped 3 different types of these products together and called them novel products. So in our study, we looked at ENNDS, ENDS, and heated tobacco products together and referred to them as novel products. So in the rest of this presentation, when I use the word novel products, I'm referring to those 3 types of new and emerging products. Just with regards to the survey itself, so the survey was conducted between January and September in 2022. The main aim of the survey was to collect data related to electronic nicotine and non-nicotine delivery systems and heated tobacco products, which, as I said, we refer to as novel products, as well as traditional combustible cigarettes amongst adults in urban South Africa. More specifically, we wanted to estimate the prevalence of novel product use in urban South Africa, to describe the demographics of those novel product users, and then specifically, we wanted to look at the sequence of use between cigarette smoking and novel product use. And by looking at the sequence of use, we explored 2 of the key questions around novel products. Firstly, that is whether novel products might be a gateway to cigarette smoking, which we refer to as an on-ramping device, or if they may be a tool for smoking cessation, as the industry often claims, and we refer to this as an off-ramping device. Just in terms of the sample, we collected a nationally representative data set of adults in urban South Africa. And to do this, we used a telephone survey where we initially called 400,000 people, and we were left with a final group of 21,263 respondents, which is a 5% response rate and in line with other telephone surveys. So just before going to the sequence of use results, I just want to touch on the prevalence figures we found for novel product users by certain demographics in South Africa. So starting with gender, we see that prevalence was significantly higher among the male population group in comparison to females. In terms of race, which are the blue bars, we see that prevalence was significantly higher among the non-Black population groups. And in terms of age, which are the green bars on the right-hand side, you will see that the prevalence was significantly higher among the younger age groups in comparison to the older age groups, with it at 7.7% for those aged 18 to 24, 6.7% for those aged 25 to 34, and then decreased all the way to 1.5% for those aged 65 and above. So as I said, we are mainly looking at the sequence of use results today from the survey. And there are two terms I want to define before I show you those results, as they're very important for the discussion. The first is an on-ramper, and we define an on-ramper as someone who used novel products with no history of smoking combustible cigarettes, but then started smoking combustible cigarettes. So just to recap, these are people that use novel products. They had not previously used cigarettes, but after using novel products, they started smoking combustible cigarettes. We then have off-rampers, and we define an off-ramper as someone who smoked combustible cigarettes. They had no prior history of novel product use. They then started using novel products and later quit smoking combustible cigarettes. So just to recap, these are people that smoked combustible cigarettes. They had not previously used novel products, but they then started using novel products and later quit smoking combustible cigarettes. So those are the two terms, on and off-ramper. Moving to the results, this first chart, which I'm going to show you in stages, looks at the sequence of use of those who use novel products first, and we use this to identify potential on-rampers. So our starting point here is that 5.5% of urban South Africans regularly use novel products. Of that 5.5%, 39% had no prior history of combustible cigarette use. So these are the potential on-rampers should they start smoking combustible cigarettes. And what we see is that approximately 1 in 5, or 19% of these people, then started smoking combustible cigarettes. So these are our on-rampers. Now, importantly, of those on-rampers, 88% were still smoking combustible cigarettes when we conducted the survey, while 12% had quit. So the key takeaway message on this slide is that of those with no prior smoking history, approximately 1 in 5, or 19%, started smoking cigarettes after using novel products. This chart now is used to identify off-rampers, and we are starting with regular smokers of combustible cigarettes this time. So the starting point here is that 17% of urban South Africans regularly smoked cigarettes. Of that 17%, only 17.3% then started using novel products. So this is where we identify for the potential off-rampers should they then start smoking, then quit smoking combustible cigarettes. And what we see is that of that 17.3%, approximately 1 in 8, or 13%, quit smoking combustible cigarettes after using novel products. Now, importantly, most clinical trials only characterize lifetime smoking cessation for people that have quit for longer than 6 months or a year. And in our survey, we see that of those off-rampers, 44% had quit less than 1 year prior to being surveyed. So we cannot characterize them with lifetime smoking cessation at this point. So the main takeaway here is that of respondents who started using novel products after smoking combustible cigarettes, 1 in 8 later quit smoking cigarettes. If we apply that clinical trial threshold, though, that 13% decreases to 7%. So here I'm just going to summarize the results in terms of on and off ramping. So what we see in terms of on ramping is that of those with no prior smoking history, approximately 1 in 5, or 19%, started smoking cigarettes after using novel products. In terms of off ramping, of respondents who started using novel products after smoking combustible cigarettes, 1 in 8, or 13%, later quit smoking. As I said, that 13% drops to 7% if we apply that clinical trial threshold. So what we find here is evidence of both on and off ramping. In terms of percentages, we have higher prevalence of on ramping, and also in terms of absolute numbers than off ramping. So the main conclusion and policy implications based on those results from the survey is that the use of novel products among young people, especially those that do not smoke combustible cigarettes, should be particularly strongly discouraged. And this is something that the Control of Tobacco Products and Electronic Delivery Systems Bill in South Africa is aiming to achieve. Another thing to note is that there's great concern that these novel products are a possible on-ramping device over and above the health consequences that they carry. And our results provide evidence of this, with 1 in 5 or 19% of these novel product users who had not regularly smoked cigarettes starting to smoke them after using novel products. And this is detrimental from a public health perspective, and novel product policy needs to address this problem. Those are all the results I wanted to show today. Thank you very much for listening. A fact sheet and a full report based on all the findings from the e-cigarette survey can be found by scanning these barcodes, or you can visit the website link on screen here to find out more information. Thank you very much.
Thank you so much, Thomas, for that presentation. I will do my recap at the end, towards the end of this session, but I would like to now open it up to other stakeholders. If you have any questions, please let us know and we will unmute you. Yes, Sandy?
Okay. Please confirm that you can hear me. Good afternoon. Thank you.
Yes, we can hear you.
All right. Thank you so much for the presentation and for this excellent research in this area. Okay, but I wanted to ask, I don't know in your methodology if you're aiming to gain a nationally representative sample, for your population. And if that was so, why did you concentrate only in the urban area? Because if you didn't take note of rural area, then I'm not sure how representative that could be. If we had rural and urban, we can also compare. And then the fact that even when you looked at your demographics, we found out that Black people, they were around 2.6%, but white and colored, I think they were around 7 to 8%, almost twice or 3 times the value we are seeing in Black. But that's going to show that, economic reality can influence the purchase of this product. So I wanted, if you're aiming for a nationally representative sample, why did you ignore the rural area? Yeah, thank you.
Thank you for your question. So we did aim for a nationally representative sample, but only of urban areas. And the reason for this is that we conducted a telephone survey as opposed to going door to door. And so we had to use information from credit bureaus in order to obtain those cell phone numbers. So the credit bureaus don't have information from the rural areas, only in urban areas. So that was the limitation on why we had to only apply this to urban areas in South Africa. In terms of the racial findings, we did apply weights to the sample to ensure that the weights made it representative of urban areas in South Africa. That is why when I mentioned the results, I should have maybe said more that it's only in urban areas, but it would definitely be interesting to look into these rural areas wherever limitations on the data collection prevented that in this study. When you're on mute.
Dr. Ziambo?
Yeah, so can you hear me?
Yes.
Yes.
Okay, so this is a very interesting study. There was a lot of clarity in terms of the presentation, and I think that it needs to be replicated to other countries, especially Zambia as well, on the e-cigarettes. I just have 2 quick questions. So I see that if we are to do an intervention, probably we are looking in terms of the colored and also the young people. Because I think that was what was more like spiking. But now in terms of predictors, because what we presented is more of descriptive studies, and in terms of the predictors, did you do any regression? I know that you can't present everything, but I was going to be interested to get to know if actually you regressed or you did some model, so that then you can get to know the predictors as to whether rural, urban, in terms of colored, white, is actually the predictor of what we are looking for the interventions.
Yes, that's a very good question. Thank you so much. So we did look at that. In the results I presented today, we just looked at sequence of use. So we were not saying that this is a causal relationship. It's very hard to say that these are the reasons that it happened. But in terms of the predictors, we did run logit and probit models to look at those predictors and find significance. There's another paper published about just those findings, which I will find and put into the chat for you to read. But we do find significant predictors from race and other demographics, which you can use to target interventions. So I will share that paper in the chat.
Thank you, Dr. Ziambo and Thomas, for that response as well. If there are other questions, please drop them in the chat. I've seen that there's a comment on the error on this QR code. We'll also share the links after the webinar. Thank you, Thomas. We'll be moving on to Noreen.
Thank you, Winnie, and thank you very much, everyone, for joining. So today I'll be talking to you about a study that we conducted in Nigeria, which was on Shisha use. The reason why the study was important include the fact that the prevalence of Shisha use is increasing worldwide, including in developing countries, particularly among young people. For Nigeria in particular, studies among secondary school pupils and also university students have reported high Shisha smoking prevalence rates of about 3% to 7%. And from the TCDI engagement with the key tobacco control stakeholders in Nigeria, there was an expressed need to strengthen the national response to the growing threat posed by Shisha smoking through context-specific data. So the stakeholders were particularly interested in data that addressed the following objectives, which also became the focus of our study. The first one was to investigate the self-reported reasons for Shisha use in Nigeria. The second one was to identify factors that are associated with the use of Shisha in Nigeria. Next slide, please. So to do this, we conducted a study. I think you skipped a slide. Sorry, Winnie. Okay, there's a slide missing. So to address these specific objectives, we conducted a sequential mixed method study where we first conducted a qualitative study among 78 Shisha users in Nigeria. And then we used the information from that qualitative study and also information from literature reviews to inform a quantitative study that we conducted among about 1,200 Shisha users and non-Shisha users. And for those studies, we used the theory of planned behavior, where we assumed that attitudes, for example, positive and negative evaluations of Shisha smoking and subjective norms, for example, perceived social pressure or support to smoke or quit Shisha, and also perceived behavioral control. For example, the participants' evaluation of the ease or difficulty of smoking or stopping smoking Shisha determine one's intention to smoke Shisha, which in turn influences whether one uses Shisha or not. And in terms of the setting from the beginning, we were not aiming for national representativeness. A decision was made to focus on geographical representativeness. So we aimed to sample from each of the Nigeria's 6 geographical zones. For this study, it was also important for us to go to those settings where the chances of finding and enrolling Shisha users is high. So there's evidence to suggest that Shisha smoking is more common in urbanized settings, where there is a high density of nightclubs and bars. So we went to the 2 most urbanized states in each of the 6 geographical zones and the federal capital territories. So for the sampling, for the qualitative interviews, In each of the states, we sampled from one urban and one rural semi-urban location. And we then purposely sampled current Shisha users from public places that are known for Shisha smoking. For the qualitative survey, don't worry, Winnie, just leave this slide. For the quantitative survey, we use the 2018-19 Nigeria Living Standard Survey as our sampling frame and selected 10 enumeration areas from each of the participating states. From those states, we chose 7 urban and 3 rural enumeration areas and then randomly selected 4 numbers and called those 4 numbers until we had 5 current Shisha users and 5 non-users from each enumeration area. Next, so these are our results. So from the qualitative study, what we found was that flavors, the association of Shisha use with pleasure, curiosity about the product, perceived health benefits, knowledge about consequences and regulation, had an impact on attitudes. They influence the attitudes towards Shisha use. In terms of subjective norms, these were shaped by pressure to use Shisha during social events, Shisha smoking by friends, Shisha smoking by family members, and also perceived societal views on Shisha smoking. In terms of the perceived behavioral control, these were impacted by the acute side effects and also availability of Shisha and the opportunity to use Shisha anyway, and the cost of Shisha and the perceived ability to quit. I'm conscious that we only have 10 minutes, so I'll talk about some of these reasons in more detail. Next slide, please. Next slide. So in terms of the flavors, we found that flavors played a significant part in the initiation and continued use of Shisha. It particularly sparked curiosity, especially among young adults. As you can see from the quote in our right, the first quote, which says, "I started taking Shisha at my first shop. I just like the flavor, and it is the flavor that just pushed me into taking it." The flavors also provided variety, and it was linked to having fun. It also facilitated the use of Shisha in places where cigarette smoking is not allowed. And also it gave the impression that Shisha is safe and safer than cigarettes. This you can see in the quote that is at the right bottom, where someone said, "Well, I stopped smoking cigarettes because it is harmful to the system. These smokers are liable to die young. I don't want to die young. I smoke tobacco, but I do not smoke cigarettes." Actually, some of our respondents did not consider Shisha to be a tobacco product at all. They considered this just as a flavor. Next slide, please. In terms of knowledge and beliefs, there were beliefs that Shisha helped with stress relief, which is something that we see also from those who smoke cigarettes. It also alleviated physical discomfort and boosted energy and agility, particularly for those who work in construction industry and also the security industry. These positive views were also influenced by the media and also the fact that there are no health warnings on Shisha and it is available everywhere. As we can see on the bottom left quote where someone said, "I've seen some guidelines about tobacco, but I've never seen any guidelines about Shisha." With tobacco, we also see it on the packets and posters that smokers are liable to die young. I've never seen any on Shisha. That's what makes me want to continue taking Shisha. Next slide, please. Some of the reasons also were peer and social influence. You find that most of the initiation happened in the company of supportive friends and also at social events. And those who had family members who are also Shisha users tend to also report that they started using in the company of those family members. Where family members disapproved, shisha use was more concealed, and this was particularly for female users. In terms of the societal view, there was low tolerance, but you find that low tolerance was more for females. There was a more positive outlook if it was a male user who was using shisha. Although there was a low tolerance for females using, it was, we also found that females reported that the societal views were more favorable for use of shisha among females than use of cigarettes among females. There was also an issue around cost and availability. You find that costs were high for shisha, and this seemed to be prohibitive, but users had strategies to make shisha affordable. For example, having their own paraphernalia and also sharing the shisha pot and splitting the costs amongst a number of users. There were also reports that shisha was very easily available, including to children, as well as in places where tobacco smoking was prohibited. And this was attributed to lack of regulation. Next slide, please. So in terms of the factors associated with current use, we looked at biological factors, behavioral factors, mental health, and social factors, and factors that are to do with neighborhood and physical environment, and other factors such as religion. I'll just talk you through the factors that we found that were associated with current shisha use. Next slide, please. So age was negatively associated with current shisha use. So an increase in age reduced the likelihood of someone using shisha. And we found that current cigarette use, current alcohol consumption, and having family members who smoke and shisha smoking among his closest friends were positively associated with shisha use. So if you are a current cigarette smoker, you were more likely to use shisha, and if you had a friend who used shisha, you were more likely also to use shisha. We found that screening positive for anxiety was negatively associated with shisha use, which is counterintuitive from what we know about smoking and the relationship between smoking and mental health. So these are the factors that we found associated with shisha use. Some of the factors that we thought would be associated with shisha use, like sex, were not associated with shisha use, which was a surprise from what we know from cigarette use. Next slide, please. So we have published these studies in PLOS Global Public Health and also in Tobacco Prevention and Cessation if you want to read more. Next slide, please. In terms of our conducting this study, it was not the Development Gateway alone. We worked with a number of partners. So I would like to convey my thanks to Aradas Consulting Limited, who led the data collection and analysis on behalf of DG, and also to our colleagues in the Federal Ministry of Health, NCD Division, and the Tobacco Control Unit, and also the National Bureau of Statistics for their guidance, support, and collaboration during study design and implementation. Thank you very much. I will entertain any comments or questions that people might have. Thank you.
Thank you so much, Noreen. I think we already have one question in the chat. Which state in Nigeria has more shisha uptake, and how is it impacting society?
So thank you so much. That was from Alfonso. From this study, I wouldn't be able to tell you which shisha state is more shisha uptake, because that was not the focus of the study. We're not looking at prevalence. We're not looking at reasons for shisha use and factors associated with shisha use. However, you'll be happy to know that we have recently also, in collaboration with the Federal Ministry of Health, we have recently conducted a study in adolescents where we were looking at the prevalence of tobacco use in Nigeria, and including the prevalence of Shisha use. So from that study, we'll be able to tell which states in Nigeria have more Shisha uptake. I hope that is helpful.
Thank you. I see we have more questions from Master Chimbala. Do you currently have adequate legislation regulating products such as Shisha? And I imagine that is in reference to Nigeria.
Yes, so thank you so much. I have my colleagues from the Federal Ministry of Health, I think, that are here, who will be able to answer this more eloquently. But what I can say is that from my knowledge, Shisha is covered by the Tobacco Control Act of Nigeria, particularly on the, including health warnings. I think the question might be on the enforcement, the compliance monitoring and enforcement of those regulations. But I'll also open the floor to my colleagues from the Federal Ministry of Health that are here, if they want to chime in. I think Emmanuel and Sunday are here.
Okay. Emmanuel, would you want to respond to that? Otherwise, I see there's more questions. I mean, there's more hands going up, but I would like to request Dr. Prosperous Daniel Kayode, if you could just put in the questions in the chat and we will respond to you then, just so that we can also manage time. That's okay. Emmanuel, do you have anything else? Okay, Emmanuel says Noreen's response was good. Thank you so much, Noreen, and thank you, participants, for sharing those questions as well. I would like to now cue Prof. Kath Edbeth, if you could share your screen. Thank you.
Confirm if you can see my screen.
Yes, we can.
Okay. Thank you very much for this invitation to present on e-cigarette use and industry targeting in South Africa. I'll just jump right into it since I've already been introduced. This is MRC, my institution, acknowledging its historical role and silence during apartheid in South Africa and its commitment to continued promotion of justice and dignity in health research in South Africa. So I thought of taking us to the origin of the e-cigarettes with regards to how the industry started thinking about it. We know that in the 1960s, especially in 1964, the US Surgeon General released the Surgeon General reports implicating cigarettes as a cause for lung cancer and probable cause for other cancers. And the industry started looking for ways to make that go away. Basically, that's what they were trying to do, to make that go away. So this is a letter from the industry documents library showing what they were thinking, that they wanted to produce something that would be regarded as a safer smoke, but it will still have the commercial and political motive as well as scientific motive. And it just was supposed to be almost like a smoke screen. Not sure why my slide is not moving. Okay, so in South Africa, the first consignment of e-cigarette came in around 2014, and the Department of Health seized the consignment, saying that this was not in line with the current regulations. And the industry took the Department of Health to court. And in their court document, you can see what they stated here, that they do not have any intention of marketing these products as cessation aids, and that it's not suitable for smoking cessation. But what we find now, if you look at this website, which is the website of the e-cigarette industry, their association, they now claim that it's a cessation aid when the country tries to regulate the product as a tobacco product. So of course that creates problem, because now people don't know where should they put them. because if they are medicines, they are supposed to go through a separate authority to get authorization to be sold as medicines. And if they are tobacco products, then they should be regulated. But the industry is always flip-flopping when it comes to this. Just to mention at the side that in South Africa, the Pharmacy Council puts in place a rule banning the sale of e-cigarettes in all pharmacies in South Africa. So as we speak, you will not find e-cigarettes being sold in any pharmacy in South Africa. Looking at the trends in the country, you'll see if you listen to Thomas's presentation, you'd hear he was talking about urban dwellers, and what we find is that depending on the data or the focus of the research, you would see different figures. This is the South African Social Attitude Survey, which started, it started really tracking the prevalence of e-cigarette use in the country since 2010. By 2018, it was 2.7, which was about over 500% increase. I can tell you for free that as of 2000 and let's say 2024, this figure is way above this 2.7. But if you do studies in specific populations, you will find that you see higher prevalence, especially with young people, which I'll discuss later. So, of course, the industry has been targeting young people in South Africa. These are pictures. Pardon the poor quality of one of them. I had to be discreet in taking the pictures. These are pictures that I took by myself in front of vape shops around a university campus in South Africa. You can see if I close the name vape, you would not know that these are products that are supposed to be, or these are adverts that are supposed to be promoting vape. You think it's ice cream or something cartoonish for children. And this is just one of the ways they target children in South Africa. Then look at this other picture, which I took in a shopping mall in South Africa, where they put this inscription. If you look at the yellow arrow, it says, try before you buy. And if you go back to what they are saying now that e-cigarettes are cessation aid, you'd see that why would you try something before you buy it? Is it that once you are a smoker and you try a vape, you immediately quit? That doesn't work like that. So you can see that this is just marketing strategies. The second picture is a vape truck that was put in front of a hospital that was taken by a colleague. We did a study, one of our PhD students did a study looking at the vape shops, the location of vape shops around South Africa. And of the 240 vape shops that were marked, they found that about 40% of the vape shops were very close to university campuses. And if you look at that would be your left, you'd see that most of these universities that are stated there and those ones that have very close vape shops to them are those ones located in urban areas. So I think it was a smart decision for Thomas's team to do the study among urban dwellers, because you would not see as much people using vapes. Even some in our global adult tobacco survey, some people had not even heard of vapes in the rural areas. So if you want to really get the true picture of how it's being used in certain populations, you would look at the urban areas more than the rural area. That is not to say some people in the rural areas are not using it, but they are not as many as you'd find in urban areas. So this other study that we did was to look at after mapping the vape shops and their location to university campuses, what we tried to do here was to look at the association between living near a vape shop and currently using e-cigarette. And if you look at this graph, on your left, it means that there is no association. On your right, it means that there's association. There's a dotted line that's a straight line in between. So if you look at the last result there, current e-cigarette use, you would see that it's on your right, which means there was a positive, significant association between living near a vape shop and currently using e-cigarette. And this study was done among over 18,000 participants. So this is another study that we try to look at the association between using e-cigarettes and quitting. Of course, what we found was that at 1 month, at 6 months, there was a positive association with quitting. But when you get to 12 months, you see that there was no association, which of course means that which of course means that if you are using e-cigarette as a quit smoking aid, between 1 to 6 months, you may see a positive result, but the likelihood that you will quit for good is very low. It's in this study, it was not significantly associated with quitting for good. And we also checked relapse. That is, do you go back to using what you were using before, like the cigarettes? And those who use e-cigarettes were more likely to relapse to using their cigarettes. So we did a study looking at e-cigarette use as well as the advertisement and marketing to university students, of course, based on the fact that we had done a study looking at the location of vape shops. And so what we collected data from almost 3,000 participants, but this presentation is about the people aged between 18 and 24. And what we found was that the prevalence of e-cigarette use was about 26%. Daily use was about 12.5%. But when you look at those who are exposed to advertisement and marketing, a great number of percentage of the students were exposed to advertisement and marketing, and then promotion. So almost 3/4 were exposed to advertisement and marketing. About 47% were exposed to promotions, and then any exposure was almost 78%. We also, of course, looked at hookah, and while the prevalence of hookah use was higher than e-cigarette use, the prevalence of current daily use of hookah was lower than that of e-cigarette. Of course, it can be explained because most of these young people who use hookah, they use it in social gatherings. They use it together when they are partying, so they may not use it every day. But for e-cigarette, of course, it's very portable, and so they carry it along. And when we looked at advertisement and marketing of hookah, we found that it was slightly lower than for e-cigarette. But we did regression analysis to look at association between currently using these products and being exposed to advertisement and marketing. And for both products, those who have been exposed to advertisement, promotion, and marketing were more than 2 times more likely to be currently using these products. So in summary, I would say, of course, there's not much time to talk in details about the health effects of these products and the myth about the 95% safety, but I just want to mention it that e-cigarettes are not 95% safer than cigarettes, as being propagated by the tobacco and e-cigarette industry. I put them together because most of the e-cigarette industries are also people who produce the tobacco products. And e-cigarettes pose many health hazards that are not even associated with smoking cigarettes. We must understand that when they say less harmful, what do they mean? Because at some point, if you look at the components of e-cigarettes, some of the components there are not even in cigarettes. And it depends on how you're using it, how often you're using it, how deep you inhale it, and how which device you're using, that you can be able to say, okay, are you even using it in a less harmful way than others? But we can't make such flipping generalization that, oh, this one is less harmful than the other. As Thomas has said in his from his study, you've seen that e-cigarettes also serve as a gateway to tobacco smoking, especially among young people. On cessation, they are not effective in helping smokers quit for good. Many of the smokers, as even indicated in Thomas's studies, we also did some studies like that. They show that many of those people who start using e-cigarette and in a bid to quit smoking end up using both products. And studies have shown that dual use it creates or carries a higher risk than using either product. So if you use cigarettes or you use e-cigarette, when you are a dual user, you have more, you experience more harms than if you're using either of these products. Lastly, e-cigarettes should be strictly regulated, especially to protect children and youth. Those cartoon characters, those ice cream and whatever flavors you're seeing, I think those should not be allowed to be used by the industry to promote these products if they really mean well for public health. Thank you very much.
Thank you so much, Prof. Kath. I'd like to open it up for just 1 minute. If you have questions, could you please let me know? I see someone's hand is up. 1 second. Yes, Sandy.
Thank you so much, Ma, for your presentation. This is quite enlightening. So I wanted to ask, what's the regulation framework like for e-cigarettes in South Africa? And how is this study informing policies? Because this is a major problem for many African countries, so that we can also borrow some lessons. But thank you so much for this.
Catherine, you're muted.
Thank you. That's a great question, Sunday. Thanks for the question. So based on that court document that I showed, the industry won the case and they brought in the e-cigarettes. And what they did, what the government did was to put e-cigarettes under nicotine products. So there is a Medicines Control Act that regulates nicotine products. So they just put it there, but based on that law, e-cigarettes should not be readily available in every nook and cranny as you're seeing it. So it's not even being obeyed. So we can say that there's no law regulating e-cigarettes right now in South Africa. But since 2018, there's been a bill that's been in the works that it's going through the legislative process. It's currently receiving public hearings at parliamentary level this year. So that law would regulate e-cigarettes if it is passed as it is. I can't remember the other question. In terms of informing legislation, these studies, some of these studies and others that we've conducted, of course, helped in the putting together the bill that is currently being processed. And we've, of course, as you would know, the industry has been pushing back, and we've used these studies to also to inform our advocacy activities in terms of showcasing what is really happening on the ground. It's worse than I've presented, I must tell you, because there have been billboards erected. In South Africa, you are not allowed to advertise tobacco products, but we can see that in South Africa now, we have billboards sometimes being put up by the e-cigarette people saying, please do vape or something like that. So it's really bad, and we are hoping that once the law is passed, some of these things, most of these things will be curbed. I hope I've answered your question.
Thank you so
Yes,
much.
thanks.
For that. Thank you so much for that. I think if we have more questions, let's pop them in the chat. And we have noticed there's a current hitch that the speakers cannot respond directly to you, but I will be able to relay any responses that they might have for the individuals who have raised questions in the chat. I see more questions. I see more hands. Let's engage in the chat so that we also give Sembe Ali an opportunity to showcase the dashboard. Thank you so much, Kat.
Thank you, Winnie. Hello, everyone. Good afternoon. Because of time, we're going to do this really quickly. Let me share my screen. Let me know if you can see my screen. Right. Can you see my screen okay?
It's still loading. Yeah, there it is.
Okay, perfect. So our speakers today, Dr. Thomas, Dr. Noreen, and Prof. Kat from South Africa, all have given us a lot of information, and I know that if you're like me, there's something you're already wondering to yourself, how can I access this information after this? There's so much that they have shared. I want to be able to come back to it at some point. And so this is your chance really to be able to do that and do that well. So we have this dashboard called the Tobacco Control Data Initiative Dashboard, and you can access it by this hyperlink web address that you see on the page up here, tobaccocontroldata.org. And when you go to this website, you will see at first glance immediately, you see that there are 6 countries that are covered under this website that hosts and houses tobacco control information in all of the 6 countries. There will be an additional country this year, Senegal. So at some point you would see Senegal will also be here. But for the purposes of our conversation today, I'm going to be focusing on South Africa and Nigeria. And so when you want to access any of these countries, it's just by clicking directly on the link that lets you get into the country. And so let's start with South Africa. Going by Thomas and Dr. Katz's presentations, you will see that the information that you're looking for here for South Africa the website has a lot of other themes. Even though we focus today on e-cigarettes, you can also see that there are other topics such as prevalence, illicit trade, health burden, taxation, enforcement, and agriculture, not just e-cigarettes. But again, for lack of time, we would focus on e-cigarettes. So clicking on that page, on that link takes us to the e-cigarettes page for South Africa. One thing I wanted to highlight really quickly is that all of the information that Thomas talked about, and so if you wanted to see the clear questionnaire, the user manual, the questionnaires, and be able to download all of the data sets, you can do that for the study that was conducted on e-cigarettes in South Africa by clicking on this hyperlink at the data and methods page. You can also download a report of the findings by clicking on this link here, and also you can download the fact sheet by clicking on this link. I know that the QR code that we had shared earlier had some problems, but we will be able to share all of those links again after this webinar. But in case you wanted to come back to it at your time, you can access them here at this page. So this e-cigarette page contains variables around prevalence. So you would see information that talks to you about what the different novel products in South Africa are. You'd see information around prevalence and taxation, and some of the health concerns that are also associated with e-cigarette use. You would also see information around the sequence of use. Of course, Thomas talked about on-ramp pass and off-ramp pass. All of that is captured here as well. And you'd also see information around the policy. Somebody asked in the chat already about novel products and the legislation. So you can read more on that here under the policy section. And then you can see examples around regulations from other African countries such as Egypt, and you can also see Mauritius, Senegal, and the likes. And the reason we always show this is important for us to be able to see what our neighboring countries are doing and what we can borrow from. Yeah. You'd also see information around the risks involved in using cigarettes, e-cigarettes, and of course, information around the vulnerability, particularly to youth and their association with these products. And one thing I also wanted to point out with this is that we will be updating this page just before World No Tobacco Day to contain more information around emerging tobacco products and nicotine products. You would have information more broadly around the different product types, some of the health impacts, the regulation, and the environmental impacts of some of these products. In addition, we would also have information that contains new data around Dr. Katz's study, and so there will be a new model on prevalence that will be added onto this page as well. So look out for that, and we'll be live before World No Tobacco Day. So if you want to have a look at this, we will link you and share all the information with you shortly. But let's go back to Nigeria, because we also had a study on the Shisha study that was conducted in Nigeria. And so under this page, with Nigeria, we have 6 other themes as well. So there's prevalence, taxation, tobacco harm, industry interference, illicit trade, and Shisha use. Because of time, I'm going to go straight to the Shisha page, but also wanted to let you know that we will be having an additional page that we're currently working on that covers novel products and novel and emerging products in Nigeria. So look out for that as well. Now back to Shisha. Noreen did a great presentation already to show you what we have learned from our study, which we typically refer to as the DGSS, the Tobacco Development Gateway Shisha Study. And as I mentioned, even with South Africa, all of the data, the qualitative, the quantitative data, the fact sheets, and all of the information can be downloaded directly from this from our website and our dashboards in Nigeria. You would see all that Noreen talked about regarding prevalence, factors that are associated with the initiation, the reasons why people are smoking and young people especially, some of the information around location, cessation, and just general facts about the use and of Shisha is already covered in all of these pages. I wanted to just get a chance to show you that this information doesn't end here just because the webinar ends today. You would have all of this information in the website to refer to as you need. So please take a moment to go through it at your convenience. I want to stop here because I'm cognizant of time, but this is, again, the tobaccocontroldata.org website. Thank you so much. Over to you, Lynn.
Thank you so much, Sembe, for that presentation. I know you were pressed for time, but I think you've done a really good job at summarizing it in such a short period of time. I know we are at 1 minute to time, but I would request that you just engage me for maybe an additional 2 minutes as I just give some quick takeaways from the different presentations we have had and next steps. So looking at the presentation from Thomas, we can see that e-cigarettes are mainly used among male population, those that are young, primarily aged 18 to 25. They are also more of an on-ramp to other products as opposed to them being an off-ramp. And the figures were shared with you. I think it was 1 in 5 ended up using other tobacco products. Looking at Kat's presentation, which also had somewhat similar findings, again, the younger population are the ones that used these products. And e-cigarette was also associated with higher likelihood of short-term smoking cessation, but in the long term, they would relapse. So if you wanted to quit permanently, e-cigarettes is not the way to go. The nearer one stayed to a vape shop, the higher the chances of being a current user. So proximity to these shops is also a factor. Looking at Noreen's presentation and the factors associated with tobacco use, age, again, young people are the ones who are using these products, which I think as we live and we all have different policies that we're working on in the respective countries, if these products are being marketed as cessation products, and yet the young people are the ones who are mostly using these products, how the people who are supposed to ideally stop using this product at the same time be the ones that are being onboarded, so to speak. So I think that is something that we need to also factor in. And the other factors associated with tobacco use are those flavors that played a big role, peer influence played a big role, and again, knowledge about health outcomes. So there's need for creation of awareness about what are these products about. We might have more questions, and I think at the point at which we'll share these presentations, please feel free to engage with us through that platform. Through the platform that Sembe has already shared, that is the dashboard, there is an opportunity to also engage the different team members. There is an email that you can reach us on, and there's also a form if you need to support by sharing any resources that you have, you can do this. So thank you so much. I know we did not have additional time to ask more questions, but we have thoroughly enjoyed your engagement and we hope you have found this to be helpful. Thank you to the speakers as well. You have tried to stay within the 10 minutes. Thank you all. Have a
Thank
good
you.
rest of the day.
Thank you.
Thank you.
Thank
Bye,
you.
everyone.
Bye.